Hi, this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart. It's nice to be here. It is Tuesday. So, this is the 39th talk. Fears of therapy. Therapy fears. How to stop before you begin. How to stop before you begin. Now, why would you want to do that? Well, people have a lot of different feelings about coming into therapy. And there's a book I was reading about. I noticed a passage in it. The book is called "A Little Life" by Hanya Yanagihara. I had to take a look at it. I always have trouble pronouncing that. Hanya Yanagihara, and it is pronounced different ways. So, but anyway, that's the book, "Little Life," and it was recommended to me by one of my youngest patients, who loved the book, and so she asked me to read it. But in that book, there's a character named Jude, and he was very damaged as a young man, extremely rejected, and he handled that. And one of the ways he handled that sometimes was by cutting himself. But anyway, we became acquainted with Harold and Julia, and they adopted him, and he didn't feel too good about himself. I mean, that was some upbringing, like the rejection that he had. He was not going to feel too good about it, but he did care about them, and he felt they cared about him. But he always had this incident that he was going to create, and that by creating an incident, he would get them to not want him. And he said in that way, he could blame it on the incident and not because they really didn't want him. That was interesting. You know, we all have this, I think many people have this feeling like if somebody really knew me, they wouldn't want me, they wouldn't like me. It's not an unusual feeling. Many people have it. And that was his variation of that. And that's why people, I introduced one of my podcasts with two quotes, which I always are my favorites. One is, "It's joy to be hidden and a disaster not to be found," and also The Little Prince. One can see, it's with the heart that one can see rightly. What is essential is invisible to the eye. Like the externals, you know, are not the important thing. It's what we really feel for people and how we feel about ourselves. And YouTube therapy, channel Therapy for the Heart, is all about the role of emotions in our lives. That's what it's all about. So anyway, these fears people have about being rejected, you know, they come to therapy with often feelings about experience about being criticized, scolded, emotionally and physically abused. They have all sorts of transferences before they get to the door sometimes, like teacher transference, and some transference is something that you paint on the person, like take a brush and just paint it all over them, and you don't really see them for who they are. And so like a teacher transference could be a terrible experience that you had, you know, under the hands of a teacher, maybe reprimanded or being told you didn't know anything. So that's what your expectation might be coming into therapy, because therapists are in the role of authority. So it could be teacher transference, a transference to a boss that you had, or an aunt that beat you up when you were little. And maybe it was an Uncle Mark. And you all of a sudden, my name in your mind has that association. So in the first talk, there's certain questions you might have about the therapists, and I tend to not answer questions, particularly, and I'll tell you why, over the phone, you know, about me or what I charge. When people are in therapy, I'll answer questions if it's going to contribute to their growth, if it's going to stunt their growth in some way by knowing something about me rather than investigating it. I always like to investigate things. Like the first talk in the videos, the first, second, and third talk are very important, and you could review them and go back and look at them. But in that first talk, the person I was talking about, she said, "Dr. Sehl, do you live here?" And I said, "Oh, that's an interesting question. Can you give me your thoughts about, you know, if I lived here or not?" He says, "Well, if you lived here, it would be one thing, and if you didn't live here, another." And I said, "Well, what the difference would be? What would be the difference?" And he said, "Well, I see you at 7 o'clock in the morning." I said, "Yeah." And he said, "Well, if you lived here, you just walk down the stairs and see me. But if you commuted and had to come a long way, And I said, yeah, and what would that mean to you? And he said, it would make me feel special. So that's why we investigate in questions in therapy. We want to know, because often the person is bringing the problem to the therapist couched in a question. And his problem was wanting to be special. Not a problem, it was his wish, because he was very badly treated by his father and beaten, and therefore they're the transference to me. And he wanted to know if I could be gratifying him, make him feel special rather than the way his father made him feel. And therapy would be, of course, going through the pain of reliving those memories in therapy. So some questions. And some questions, here's another example. I was just talking to a patient, and I asked her if I could include this in the talk. I just got off the phone with her, and she was sexually abused by her therapist. Horrendous thing some therapists do with their patients. It happens. And I did a study on the incidence of erotic countertransference in clinical social work practice, so I found out these things happen. And I was really more interested in the training that therapists have about the countertransference, but that was my study was about for my PhD, and it was published actually. But so she came, when she first came to see me, she from another country, and she couldn't make it into the doors. She was that terrified that the same thing might happen to her. Again, how could she know? She didn't know me. So I went out and I escorted her in, and she continued in treatment with me. In treatment, she's doing fantastic now. So it's quite a few years. What a progress, and she is herself. I'm going to stop there. But anyways, making a lot of progress. So one time she said, "Could you read me a fairy tale?" And I said, "Sure." I investigated it with her for a while, but I also did it. I read it. Now, she was a person who was not favored at all in her family. She never fit in. She was like the oddball out, and never. So she was never held as a little girl, by her father. I mean, she's just dismissed. She's a scapegoat. So it was good for me to read to her. Didn't hurt the therapy, We talked about it, the meaning of it, significance of it. So some other people would come in and know. They might ask me, "Can I read a fairy tale?" I have to know them very well in order to do that, and I'm not going to read a fairy tale to everybody because everybody's different. You're an individual here, and so I want to treat you that way. So some of the questions, though, that we're talking about, questions that people ask, and how you can stop yourself before you get here is, for instance, asking questions about fee. Supposing you say to the therapist, "What's your fee?" over the phone, and he says, "Well, it's $150." Right? Or, well, whatever you say. Well, I'm sorry, I can't afford that. Or somebody else calls the next person. He says, "My fee is $125. Gee, I can't afford that." And what's happening right there? Or same thing about questions about your training. How often have you been? How long have you been trained? How long have you did this work as a psychoanalyst? Who were you trained by? Where did you go to school? Are you a doctor? I don't answer those questions over the phone, because what happens is that the minute you say something, it's not the right thing. It's not what they are expecting, because they don't really know what they're expecting, and they also don't know why they're asking. Ultimately, they really want to know if they're going to be in good hands, but they're not going to say, "Am I going to be in good hands with you?" How can you assure them of that? So what I do is I don't address those questions over the phone, because if you do, it's like an end run around therapy, an end run around their conflicts and their fears. They don't have to deal with. They can just say, "Well, you don't have enough experience," or the fee I can't afford. So my policy is when they come in, I say, "Well, why don't you? We'll talk about that when you come in. I'd like to get to know you when you come in. So come in, and if we agree on a fee and we agree to work together, it's always your decision and my decision, and we agree all that. Then I will charge you that fee for that session and for subsequent sessions. If we don't agree on to work together, then, then you're free to go." You can think about it, come back and talk to me about it, or you may never come back. But you know, it's you may want to see other therapists, and how can you know which person is going to be the right one for you unless you really see them and talk to them? And even that you might have some questions about, so you could be free to go and come back and ask some questions later on too. But that way you have a ability to establish some kind of working with each other for that one session, so the person can get to know how you are and how you respond to them in terms of what they bring up. And that's going to be a very important part of knowing that therapist, how they respond to you. Do they get defensive if you challenge them, or are they comforting? Do you feel understood? That's a big thing. You want to walk out feeling something has been understood, and that you have a little hope, about dealing with your problems. So that's therefore back to the title of Therapy Fears. I don't know if it was Freud or not. He told a story about this man. You see, fears are very, very, can be very, very, very deep, and resistance needs to be respected. We used to say in the old days, resistance, we talk it like as a bad thing. Well, now we respect resistances because they're there for a reason. The patient wouldn't have them if he didn't, so we respect them. We don't challenge them. And sometimes people can be so afraid they can push themselves into therapy, and it's not a good idea either until they maybe settle some things inside themselves first. And I think it was Freud told a story about a man riding across the lake. And he didn't realize, on a horse, and he didn't realize how thin the ice was. So when he got to the other side, he had a heart attack upon knowing how thin the ice was. So this is Dr. Mark Sehl for the YouTube channel Therapy for the Heart. It's good to be here today, and I hope you find this information interesting. And if you're considering therapy, it might help you find a way to approach it that's comfortable for yourself, and which could be asking a question about the fee, and the therapist to say, "Here's my fee," and then you're all set to go. And it could work out that way too. It doesn't have to work out the way I suggested. I'm just sort of preparing you for what you might do to hang yourself up about ever getting into therapy because of fear. So I hope it's been helpful. If you like this talk, you can press the like button on it. I would appreciate that. You can subscribe to the channel. You just need a Gmail account, and you can make comments. I address the comments. I write back to you on the YouTube page there. So I hope you do that, and if not, then you know how to find me. It's Mark Sehl on YouTube. Just put Mark Sehl and YouTube psychotherapy, and also the podcasts are out now. It's the one that came out today on the conscious and unconscious factors that influence relationships. It's the unconscious primarily. That's the talk. And how the unconscious influences your choices in relationships. It's a very interesting story in there as part of the podcast. So that's on SoundCloud. That's soundcloud.com/Therapy for the Heart. And it's Therapy for the Heart, no spaces. All right? But here we are, Therapy for the Heart, the YouTube channel, Dr. Mark Sehl, and I'm going to sign off for now. And I'll be looking forward to seeing you next Tuesday with Mark. And we have 2 Tuesdays. They both come out on the YouTube and on Tuesday, and also on the podcast. All right. So bye for now. Thanks for listening.